So we are here to talk about the Scarlet Fever and Kawasaki disease, and we say that Kawasaki disease, say the Scarlet Fever has the group caused by Group A Streptococcus, and the Kawasaki is caused by autoimmune vasculitis and post-infectious. The onset for Scarlet Fever is usually after a strep throat or skin infection. The one for the Kawasaki is children less than 5 years old and is always a spontaneous onset. So, what about the fever? The fever is moderate for Scarlet Fever, but the one for Kawasaki is a high fever greater than 5 days. Scarlet fever presents with sandpaper, that sandpaper rash on the palms and the soles and periorbital area, and there's also desquamation at 7 to 14 days. But for Kawasaki disease, it's usually that red swollen hands and feet, and they also have the peeling, the desquamation in the subacute phase. In the findings, you see that scarlet fever have strawberry tongue and sore throat, which is the same in Kawasaki. They have strawberry tongue, cracked lips, and sore throat too. In other clues, scarlet fever have lymphadenopathy, rapid strep positive, and response antibiotics. But in Kawasaki, they have a bilateral non-purulent conjunctivitis and also extremity changes and cardiac involvement. The treatment for scarlet fever, they can respond well to penicillin or amoxicillin to prevent that rheumatic fever. But the treatment for Kawasaki disease is IVIG plus the high dose of aspirin. And always take note, this is the only condition in children where you can give them high dose of aspirin, very high yield for the exam. And also monitor for coronary aneurysms. So for scarlet fever, what are the red flags? The positive rapid strep antigen or strep culture, the sandpaper texture on the trunk with the secomoral pallor. And you see for the Kawasaki disease, they have that fever greater than 5 days and they are very unresponsive to antibiotics. They may also have that bilateral bulbar conjunctival injection without exudate. They also present with a erythematous lips and a strawberry tongue, and also the erythema and the edema of the hands and feet. So they may also have that periunguinal peeling and also the cervical lymphadenopathy. So for both conditions, they share strawberry tongue. Very important. Both of them share very strawberry tongue. Do not anchor on this finding, okay? Because both have strawberry tongue. The fever duration is usually greater than 5 days. Bilateral conjunctivitis and extremity changes should immediately raise suspicion if you are suspecting Kawasaki disease. And they also need to do a echocardiographic evaluation because of possible coronary artery involvement. So this is the treatment, the breakdown of the treatment. For scarlet fever, you can give them penicillin. If they are allergic to penicillin, you can give them azithromycin or cephalosporin. And the goal is to eradicate GAS to prevent acute rheumatic fever and the post streptococcal glomerular nephritis. And the one for the Kawasaki disease, there is a IVIG and with a high dose of aspirin. And the goal is to reduce coronary artery aneurysm and the risk, and they follow up with echo at 2 to 6 weeks. So just remember the goal for scarlet fever is to eradicate that gas. That full meaning of gas is that group A streptococcus.